All right, today we're tackling a big one. It's a condition that affects hundreds of millions of people all over the world, but somehow it's still widely underdiagnosed. We're talking about chronic obstructive pulmonary disease, or COPD. And to help us break it all down, we're using the global standard for doctors, the Gold Guide. So let's jump right in.
To really get why this is so important, let's just start with a number. 3 million. That's how many people died from COPD in 2021 alone. It's just a staggering figure, and it really puts the massive global scale of this disease into perspective.
In fact, COPD is one of the top 3 causes of death on the entire planet. But, and this is the most critical thing to remember, the real theme of this whole explainer, even though it's a huge challenge, COPD is both preventable and treatable. There's absolutely hope, and there's a clear path to manage it.
Okay, so let's get down to basics. What actually is COPD?
So COPD stands for Chronic Obstructive Pulmonary Disease. At its heart, it's a lung condition that causes long-term breathing problems. Now, the key phrase there is persistent airflow obstruction. And that analogy on the screen is perfect. Imagine trying to breathe out forcefully through a really skinny straw. That feeling of constant resistance, that's a great way to understand what it can feel like.
So what does that feel like day to day? Well, the common symptoms are things like dyspnea, which is just the medical term for feeling short of breath, a chronic cough that you just can't seem to shake, producing extra sputum or mucus, and getting chest infections over and over again. You know, if any of that sounds familiar, it's definitely a sign to pay attention.
Now, let's talk about one of the biggest misconceptions about this disease. What really causes it?
You know, this chart really changes how you think about it. Most of us think of lung disease as something that just happens when you get older. But what this shows is that our lung health is a journey that lasts a lifetime. Some people might start out with lower lung function from childhood, while others have a really fast decline as an adult. The point is, the road to COPD can start decades before any symptoms show up. The bottom line is, it's not just one thing. As the Gold Report puts it, it's this complex mix of our genes and our environment, all interacting over our entire lives. It's just a much, much bigger picture than most people think.
And this is so important. For years, people just wrote COPD off as a smoker's disease. And don't get me wrong, smoking is a major cause. But it's not the whole story. Not even close. Just look at this list. You've got genetics, problems with how lungs develop, air pollution, even childhood infections. This is a game changer because it helps break the stigma and shows us that a much wider range of people are at risk.
Okay, so if the causes and symptoms are all over the map, how does a doctor actually land on a definite diagnosis?
Well, the whole process usually starts right here. A doctor starts to think about COPD when a patient comes in with those key symptoms, that persistent cough or shortness of breath, and they have a history of being exposed to risk factors, things like smoking, or maybe dust at their job, or living with a lot of air pollution.
But that makes you wonder, right? I mean, lots of things can cause a chronic cough or make you feel out of breath. So how did doctors know for sure that it's COPD and not something else like asthma?
The answer is one single definitive test. It's a simple breathing measurement, totally not invasive, called spirometry. This right here is the gold standard for diagnosing COPD.
So how's it work? It's pretty simple, actually. Spirometry measures 2 things: how much air you can blow out in total, and how fast you can get it out. If you look at the left, that's a normal, healthy breath. A huge volume of air comes out really quickly. But now look at the right. See the difference? A smaller amount of air comes out, and it comes out much more slowly. That's the classic signature of airflow obstruction. You can literally see it on the graph.
And this chart shows that final step to confirmation. A doctor calculates the ratio of air you can force out in 1 second compared to the total. And if that ratio is less than 0.7, even after you've used an inhaler to open up your airways as much as possible, then the diagnosis is confirmed. It's a really clear-cut process.
But, getting the diagnosis is really just the beginning. The next step is to assess the disease, to really understand how it's affecting each person as an individual.
And this is where modern medicine gets really smart. The treatment isn't one size fits all. Doctors use a tool like this one, called the ABE assessment. It combines how severe the airflow problem is with the patient's symptoms and their history of flare-ups, or exacerbations. Based on all that, they're put into a group A, B, or E, which then guides a truly personalized management plan.
So this leads us to the most hopeful and empowering part of this whole thing. How is COPD actually managed?
It really comes down to 4 key pillars. First, and this is the most critical one for smokers, is quitting. It is the single most effective thing you can possibly do to slow the disease down. Second, get vaccinated for the flu, pneumonia, COVID, because those infections can make COPD much worse. Third, medications, usually inhalers, help open up the airways and manage symptoms. And finally, pulmonary rehab. This is a program with exercise and education that's proven to improve symptoms and quality of life.
And that brings us right back around to that core message from the Gold Report. It's so important, it's worth saying one more time. COPD is common, yes, but it is also preventable and it is absolutely treatable.
So if there's one thing to take away from all this, it's that getting an early and accurate diagnosis is everything. It's the key that unlocks all those management tools we just talked about. This is a massive public health issue because so many people out there are undiagnosed. They might just dismiss a cough as a smoker's cough, or assume getting breathless is just a normal part of getting older. But it's not. Recognizing the symptoms and getting that simple spirometry test can give people the power to slow the disease down and live a much fuller life.
And that leaves us with one last big idea to think about. We've seen how the groundwork for COPD can be laid way back in childhood or early adulthood. So, what if we could change our focus? What if, instead of just treating the disease, we could actually prevent it from ever taking hold in the first place? Now that is the next frontier.